James K. Sangmau, Bode Menteri koit khiah, Harangkat Bot Principal Secretary Wakmi koit khiah Sempat Kumar Mentakasni Kilaidon Lang Haka Indian Institute of Public Health Kabadon Hasilong Kalaplay paidbah Yaka Bachelor Program Haka iadei But Ka Public Health and Convocation of 2019 Master of Public Health Students Yakani Kijilang Lapalong Hapalor Jonkani Jaka Ajingikai Kabadon Halamali Haba Ajingkam James K. Sangmau Lakran Sepang Jinungkam Badoni Kijingtei But Kitiar Kitar Kibabiang Haka iadei But Koit khiah Bah Hakum Kani Kapor Bakarihi Borok Kawai Kadon Hapadeng Kijingshakta Now Khlam COVID-19.
I believe that today the idea of public health is also to promote wellness in a physiological, mental and emotional aspect as well. We need to move away from an exclusively clinical medicine-based system to making concerted efforts towards public health through a multidisciplinary and a multi-sectoral manner. We realize that we need to integrate streams of knowledge from diverse disciplines, bring together learnings and perspectives from life sciences, quantitative sciences like biostatistics and demography, social and behavioral sciences like economics, anthropology, political science, ethics and management, that was as mentioned by Professor Reddy. But we all understand that this is not going to be easy because for India, the new agenda for charting out a pathway for public health did not begin after the pandemic. India was already battling a paradigm shift, one that involved an epidemiological transition which came with a rising burden of chronic non-communicable diseases, a demographic transition where despite the country being one of the youngest, we have a slowly increasing elderly population, and of course, the talk of the day, environmental transition, which is contributing its own share towards catalyzing diseases. And on top of that, there is the unfinished agenda of maternal and infant mortality, HIV/AIDS, vector-borne diseases, and other communicable diseases. All of this combined continues to exert an immense strain on the overstretched health systems of our country. This is impeding the formulation and implementation of policies as well as access to quality health services in our country today. The point, I feel, is not to spread an environment of apprehension. That is not my intention, or to spread fear. More than anything, it tells me where the youngest and brightest minds of this room are going to focus their energy tomorrow for solving some of the most compelling challenges of a developing state and a developing country. In the past and in the ensuing decade, there has been an increasing number of policies to allow for the fluidity of private investment in health systems, which are being forced to make abrupt switch to market-based governance styles. Unrelenting advocacy for the same is also reducing the role of the state in public health, which in turn is allowing for an overall compression of public expenditure. The common perception is that public systems of health are weak and the more expensive private systems are efficient. This is the perception, very unfortunately. As elitist as this pathway is, this is coming at the behest of opening doors for the public to slide into indebtedness without sufficient safety nets. COVID has shown us why public health is a concern of national security. As Mr. Sempat Kumar said, a small germ like COVID has shown us and brought us the whole country to its knees. And this is not because you or I have been affected. It is because the majority of our country who have not had the access to education, who have not been able to afford sanitation and open spaces, and have had less access to quality healthcare, time and money, are the ones who have taken the major hit during the pandemic. Therefore, public health service for all of us here should be fully organized and incorporated into our governmental system, because the returns are 1,000-fold in terms of economic benefits, and infinitely more in reduction of suffering and promotion of human happiness.